Welcome back. In the previous meeting, we were discussing physiotherapy techniques of chest clearance. Okay, so we discussed a number of techniques where we talked about the traditional techniques, which included postural drainage. We also talked about modern techniques, as well as the techniques that use devices. So we continue we continue talking about means of clearing the airway and how to make airway clearance a success. Okay, so today we are looking at humidification, hydration, and rib springing. Our objective to discuss or describe the processes referred to as humidification, hydration, and rib springing. So humidification is a technique used in respiratory physiotherapy, okay? It involves adding moisture to the air a patient breathes in. It is beneficial for patients with respiratory conditions such as COPDs. As we are all aware, when you have as we are going to learn. COPDs are part of the conditions that are characterized by blockage that is caused by accumulation of mucus. So these mucus plugs can accumulate and they can become so dry to the extent where they need some moisture for them to be soft and to be removed. So humidification helps to moisten the airway passages, making it easier for patients to breathe, reduce the irritation, and improve the effectiveness of the mucociliary clearance. Because in those conditions, due to stasis of secretions, the ciliary apparatus is also non-function. So nebulization, humidification comes in to assist with that. So let's quickly look at how it is done. You put your equipment together and you put all you need. You need a humidifier, sterile water, clean nebulizer, a mask or mouthpiece, and a towel. Prepare a humidifier, fill the humidifier with sterile water according to the manufacturer's instructions, which you are going to see the instructions on the device that you'll be using. Ensure it is clean and in good condition. Prepare this nebulizer, add any prescribed medication or solution that you would want to administer as at that time. Part of what you may want to administer as at that time could be painkillers such as steroids, or painkillers such as steroids, or any other medication that may be of need to be administered in such a way. You can take that advantage and do it at the same time. Patient positioning is very important, and that is dependent on the patient's condition. Make sure that the patient is comfortably positioned. Usually, the recommended position is semi-reclined or sitting position. You can use pillows or give them. They can be on a chair where they are upright, or any position that they can tolerate. Humidification. Connect the nebulizer to the humidifier. Turn on both devices, ensuring that the mist is visible. The humidified air helps loosen the mucus in the airways, and this can be done through a mask or a mouthpiece. Treatment duration, typically it can take around 10 to 15 minutes for the whole process to complete. So you can keep on humidifying for at least 10 to 15 minutes. Keep on monitoring the process and make sure that you pay attention to the patient's gestures during the process. Okay. After the treatment is done, turn off the nebulizer and the humidifier. Help the patient clear any loosened mucus by assisting with coughing or controlled coughing techniques. which also helps to do what we were talking about in the previous lectures, where we were talking about traditional means of clearing secretions. So, meaning you can start with humidification, then do the traditional means of clearing the secretions so that you achieve better results. We talked about assisted coughing or facilitated coughing or forced expiratory techniques. We talked about this. So before they are done, you can do humidification so that you achieve better results. Then you clean the gadgets, the devices that you are using, clean them and pack them accordingly and according to the manufacturer's guidelines on how it is supposed to be kept. Make sure that to prevent it from contamination. It is a better way of starting the clearance of the airways, as it could also be done in the patient's comfort at their own time. Then after that, then you do active techniques. Hydration. Hydration chest physiotherapy is a technique used to help mobilize and clear mucus from the airways in individuals with conditions such as COPDs, among them cystic fibrosis and a larger spectrum of chronic obstructive pulmonary diseases. In these conditions, as I earlier alluded to, like in cystic fibrosis to be specific, there is drying of these mucus secretions. Once they dry up, they make up plugs which become very dry and sticky. So you hydrate, you humidify to make them soft. Then now you hydrate, okay? In which you are going to employ techniques that will help to mobilize and clear the secretions, okay? A general technique for hydration in chest physiotherapy include positioning, very important, just as we have already discussed on positioning. Okay, the patient should be with head elevated at about 30 to 45 degrees angle. Then deep breathing exercises should be encouraged. Encourage the patient to take slow, deep breaths to fully inflate the lungs. This will help open up the airways and loosen the secretions. Okay, after breathing exercises, then you can do percussions, okay, which can be done for about 5 to 10 minutes, then postural drainage, okay, as discussed in the previous lecture. So these are just things, if you put them in this order, you are assured of getting the desired results. Okay, you start with humidification, then hydration. Okay, so this is just a picture showing part of the techniques which we discussed in postural drainage, where we discussed breathing exercises and tapotement techniques, massage techniques to loosen the secretions, and forced expiratory techniques so that the patient can breathe out the accumulated secretions. So here we are just seeing another component helping us to remember the techniques that we discussed in postural drainage following different positions. So after you are done with hydration, you put in these positions and do what is known as hydration. Okay, the coughing and huffing techniques, as discussed, can also be encouraged and let them be done or repeated. Okay, let them be repeated depending on the condition, and this process may need to be repeated several times. Therefore, adequate hydration is crucial for the technique to be effective. Okay, encourage the patient to drink plenty of fluids to keep mucus thin and easier to clear. Okay, so we were talking about moisturization in humidification. During hydration, the patient need to be fully hydrated. They need to have a lot of fluid so that the whole process, including the mucus that needs to be pushed out, is moisturized. Okay? Keep on monitoring the patient, keep on checking the responses and paying attention to their gestures. If there are any signs of distress, and if the patient becomes tired, stop and allow them to rest After they have rested, you can continue. Okay? And the other part we are talking about is rib springing. Rib springing is a chest physiotherapy technique used to improve, used to help improve lung function and clear mucus or secretions from the airways. It is designed to improve rib cage mobility, which can be restricted due to musculoskeletal diseases, injury, or postural problems. During rib springing, the therapist applies controlled pressure and movement to the rib, helping to restore normal rib motion, alleviate pain, and improve breathing. So this is a manual technique that is meant to improve mobility of the rib cage due to any of these conditions. It could be musculoskeletal, it could be neural problem where the innervation of the muscles that ensure that the rib movement is attained are compromised. This technique can help, and this can be beneficial for individuals with rib cage pain, breathing difficulties, or other related issues. Position, as earlier discussed, make sure the patient is kept warm, okay? Is kept warm, gentle breathing exercises to relax the patient and prepare them for treatment. Explain to them the procedure and place your hands behind the patient. Stand or sit behind the patient, place your hands on the sides of the rib cage, okay? Stand behind the patient and put your hands in the on the sides of the rib cage, with your fingers resting on the sides of the ribs. Use your hands and fingers to gently press down and then release, allowing the ribs to spring up. So this technique is where you now start pushing the ribs in and let them spring up to their original position. You should aim to focus on one rib at a time, working your way up and down the rib. Okay? As you are doing this, instruct the patient to take a deep breath as you press down and exhale as you release the pressure. This will help mobilize the mucus secretions. Repeat this several times as you continue. So this whole process will make sure that the rib cage is mobilized. Depending on the patient's condition, you may repeat this process several times during the session. Be attentive to the patient's comfort and the tolerance. Make sure you pay attention to the gestures the patient is giving out. Encourage the patient to cough after the rib springing and to clear any loosened mucus. Post-procedure, after the session, help the patient with any necessary postural changes and ensure they are comfortable. So all of these are just telling us about how we are supposed or how we can conduct the mobilization of the rib together with the enhanced chest clearance. So all of them are actually leading us towards the enhanced chest clearance. So this is just a picture showing how you can do it in this position. So you can do it with the patient, with the position that the patient is comfortable with. Okay, it can be done in lying position. Okay, it can be done in sitting or standing. So all the position is dependent on you as the therapist and what you think the patient can tolerate. Okay, this is where we end. Thank you so much for your attention.